So hi everyone, thank you for coming along to hear me speak. I'm going to talk today about implementing evidence-based practice because, as I'm sure you're aware, I'm sure you've had it spoken to you, lectured to you many times of what the evidence is, but actually knowing how to implement it and how to figure out how to do this in clinical practice is a big challenge. And I've been on a journey myself to go from a chiropractic clinic to my own practice now, and I want to share with you that journey and hopefully make it make sense to you a little bit as well. So just a little bit about me to start with. Just as a quick opener, I've got some numbers and they mean something about me, and I wanted to see if anyone wanted to offer some suggestions as to what these numbers mean about me. So the first one is 23. It's quite an easy one, so if anyone wants to come in for the easy one first. Any guesses? No, no guesses? What about you, Professor Byfield? Do you know what 23 is?
It's probably your age.
Oh, correct answer. Excellent. So yeah, 23 is my age. And the next one, 9. Anyone got any guesses? No, okay, no worries. So 9 is the number of months that I worked in a what you would call normal chiropractic clinic. So not actually very long in the grand scheme of things, having been graduated for almost 2 years now. I'm gonna read out the rest of them. If anyone has any guesses, obviously feel free to jump in. I can't see the chat, so if anyone is putting anything in there, it's best to just unmute yourself and share it out loud. So 11, any guesses about 11?
It's 11 months you've been in practice.
Working by,
sorry, say that again.
working by yourself?
Oh, good guess. 11 is actually the number of chin-ups that I can actually do in one go, which is a big achievement for me because just over a year ago I couldn't do one. So it's been a big cool journey for me in that regard. And 6 is actually the number of clients that I saw last week. So you might think that's not very many, but obviously when you start a business, it starts off very small. And that's a big comparison to number 38, which is the number of patients that I saw in my busiest week when I worked in a normal chiropractic clinic. So as you can see, there's quite a big difference in the number of clients that I'm seeing now compared to then. And for me personally, I prefer seeing less people. But I know that that's a subject that many people have different opinions on. So I'll be glad to hear your views on it and have any questions at the end. So a bit more about me. Graduated from WIOC in 2019, so coming up 2 years now. And to give myself a polite way of putting it, I was quite academic, so I enjoyed learning about research particularly, and doing as well as I could in exams and assessments and so on. So you might think that someone like me has it all figured out when you graduate because you've done well at all the exams, but I thought maybe I might be able to save the world with chiro with my magic hands. And I was lucky enough to achieve some awards at the graduation ball, and this is a photo of me outside WIOC with my dissertation. So I really enjoyed my 4 years at WIOC until the last term of 4th year, when these guys showed up. You may know these guys, Paul and Luke. They showed up in 4th year to give us some guest lectures about exercise prescription and pain science and so on. And you might have been introduced to these concepts by them, but this was in the last term of 4th year when we were already revising for our final exams. And to be honest, I was quite annoyed. So they came in and they were giving us all this evidence and making me really question what we'd learned in the curriculum, because they were talking about evidence-based practice. And I was thinking, well, wasn't the stuff that we've been taught last year evidence-based practice? For example, I remember we were talking about orthopedic tests, and I remember Paul talking about how certain tests weren't really very specific or sensitive to pick up for example, meniscus tears or SI joint pathologies. And I remember being very annoyed and putting my hand up in the middle of the lecture and asking Professor Byfield, what the hell was the point of us learning for the past 3 years if most of this stuff was useless? And it was a very difficult question, but now reflecting on it, I can see that the stuff that we learned was useful, but that evidence changes and you have to keep up to date with it. So there was a lot of interest in what Luke and Paul had to say, but not all of it was positive. And it was a real difficult situation for me because the cognitive dissonance that I had was very great, because I thought, well, these guys are doing a lot of exercise with their patients, which we've heard in the guidelines is good, but that's not really chiropractic because they're not putting their hands on people, and how are we going to actually do that ourselves? And so the implementation of evidence-based practice was a big challenge, because I've been in the clinic for a year and hadn't been doing super loads of exercise with my patients. I've been trying to, but it's really hard when people come in expecting you to crack their back. So it was a difficult time. But I graduated and went off into a normal chiropractic clinic job, which I'd heard good things about this clinic that I wanted to work in. However, a couple of weeks and months into the job, I started to question what I was doing and what chiropractic practice was going to be like. And because university had taught me all the guidelines, clinic had taught me about patient interaction and writing up cases and patient management, but I don't think anything could prepare me for a real chiropractic clinic, because it's a business and private practice is generally about making money. Of course, they want to help patients, but they want to make money too. And you can earn a very good living from being a chiropractor. But some of the things that chiropractic clinics do may be not following evidence-based guidelines. And when you feel like you're on your own in that scenario, it's a big challenge. So I worked in a clinic that had an X-ray facility. And if you work in a clinic that has an X-ray facility, it's a private practice. You're going to bet that they want to use that X-ray facility because it's going to make them money. Now, whether that completely follows the IRMA guidelines, maybe they say that they're X-raying for a certain reason. Maybe some clinics still X-ray every patient. And that was a big challenge for me, because I'd learned all this evidence about degenerative changes and so on not being as important as we used to think. And why do we need to tell patients that they've got a degenerative disc disease when actually it probably isn't the cause of their pain? So that was a big confusion for me. There are a lot of limitations of a chiropractic clinic, because you have to meet certain appointment times, you have to use the equipment that's in the clinic, there's not a lot of space if you want to do exercises with your patients. And so I felt that the environment was really limiting me. I also had some interaction with my colleagues who'd been in the same year as me at some of the PRT meetings that I did as part of the Royal College of Chiropractors PRT scheme. And some other people were having some issues as well, for example, with things like scripts, saying that you had to say a certain line to a patient when they said something to you. Also giving the same advice to pretty much every client, even if they had different problems. So, for example, to rest, ice, and so on, even though maybe that may not have been the most evidence-based thing to do or the most useful thing to do for that particular person. So it was a big challenge. I also worked at a clinic where pretty much everyone with lower back pain was diagnosed with a disc issue. And when I worked in the WIOC clinic, I didn't really see that many patients who I thought had disc problems. There may have been a few, but especially acute pain, I didn't see very much of that in the clinic when I was in 4th year. So seeing a lot of acute patients was very different for me. And I was speaking to some of the other chiropractors that worked in the clinic where I was working. And they said, actually, diagnose people with a disc issue, even if there's a bit of a question mark about it, because if they go and have an MRI scan, it's going to show up a disc issue most likely anyway, so you won't be wrong. And that really annoyed me, because when I wanted to get out the systematic review done by Brinjicki in 2018 that said that pretty much everyone's going to have a disc issue or disc herniation or some degeneration, depending on their age group, particularly as you get older. But they didn't want to listen to that. because I'm a young, inexperienced chiropractor. So if you start to say things to your patients that don't fit in with the narrative of the clinic, it just creates sort of hostility and confusion because it doesn't make sense with the environment. So that's something that I learned really early on. And I got a lot of I got told to basically mold to the clinic and not come in with my new ideas. So that was a big challenge for me. When this stuff's up on the wall and you're trying to talk about pain not being related to structural changes, sometimes it can be in some situations, but not in all. And so when you're saying something that doesn't correspond with what's on the wall, it's just going to confuse the patient, and then they're not going to come back. And so after 3 months, I just decided that everything was rubbish and I wanted to quit everything. I didn't want to work in a clinic anymore. I didn't want to be a chiropractor. I was thinking, how am I doing such a bad job? I thought when I came out of uni that, you know, I knew all this evidence. I'd done pretty well in the exams. I knew how to adjust people. I thought I could talk to people and make them understand what was going on. But my patients aren't getting better. My patients aren't coming back. You know, what am I doing wrong here? So I really, really struggled at the beginning, and it was a big challenge for me. I also found it difficult to communicate with my colleagues because I was an inexperienced chiropractor who was young and full of these, you know, research ideas, and it just wasn't supported by my colleagues, and that was really difficult as well because I felt like I was alone in the clinic. That was my one-liner, but the research says people didn't want to listen to what I had to say about the research. I'd come in with saying, you know, we don't need to X-ray everyone because they're going to have these changes anyway. But if a clinic's business model is built on what's been working for them, there's no motivation to change. So what I was saying didn't make any sense to them, and they didn't need to change because it was working for them. But it was the wrong environment for me. I also started following a lot of physios and chiropractors on social media. For example, people like Craig Liebenson, Adam Meekins, Ben Cormack, and the things they were saying were supporting what I was thinking and what I was learning and what I'd learned at uni. So it was really strange because every time I went on social media, I was seeing all this stuff about pain, you know, being an alarm and increasing exercise adherence and so on. And then I went to work and it was just the complete opposite. So it was a really difficult time for me. And I thought, well, maybe it's just the wrong clinic. Maybe I just need to get a new job. So I went to see lots of other clinics in the area. I met up with other practitioners. I went to speak with local experienced chiropractors who were maybe part of the Royal College and so on. And they were really helpful to me to reassure me about my uncertainty. But I also found that everyone says they're evidence-based, but evidence-based practice, what the guidelines say and what they're doing, I don't know whether they're the same thing. And that's obviously a matter of opinion, but evidence-based practice for, let's say, lower back pain, we all know is to educate the patient, to give them advice on self-management, to encourage them to stay active. You know it already. I don't need to tell you that stuff. But that kind of stuff wasn't being done so much as manual therapy with a little bit of exercise, maybe stretch on the side. So that's a really big challenge because the expectation that the patient has plus what the clinic offers are maybe not as evidence-based as people think. So I decided to go and shadow Luke, and I experienced Luke a couple of times. He'd been at the lectures in 4th year, and he'd also done a lecture in 2nd year when I went to a student conference. And I really liked the way that he worked, that I could see through his social media. So I thought, let's go and see what he's got to say. And I realized that the difference between the way that he worked and the way that other chiropractors worked was about the environment and the expectations. And so if I was fighting against the normal clinic where I was working and trying to change the expectations of the patient, the environment wasn't going to support that. So it just didn't make sense to continue working there. However, unfortunately, I was renting a house and can't just stop working because otherwise the bills will add up, and there's only so many times you can ask for support of the bank of mum and dad if you have that available to you. So, you know, you've got to make sure that you can pay the bills, and the chiro job, they pay quite well. I was earning a good amount of money, but I was very unhappy. I mentioned earlier that in my busiest week, I saw 38 patients for treatments, and some of them included new patient consults as well. And I got 50% of the treatment fee as part of my agreement with the clinic I was working in. So I was earning somewhere in the region of £700 to £900 a week, and I could not have been unhappier. I dreaded going to work. I was so unhappy. It was just rubbish. The money did not make it better for me. So Luke gave me the opportunity to be mentored by him and to be able to try to implement my own way of evidence-based practice. And at this point, I kind of realized that I was going to have to leave this clinic where I was working and do my own thing, because it just wasn't going to marry up and be wonderful and happy in the end. So I had to keep working in the clinic, but I decided to stop making it such a big deal. I tried to not stop caring about my patients, but stop caring about the outcome quite so much, and just have a good conversation with the patient and make sure that they were listened to, they were heard, and stop trying to take on the responsibility of getting people better, because I think that is such a difficult scenario where you feel like you have to do something to make them better, even though particularly with acute patients, they're going to get better on their own anyway. So this is a really good picture that I feel like I've been on this journey massively. So the idea is that I came out of uni, thought I knew quite a lot of stuff, felt pretty good, knew what I was doing, started to question pretty much everything, and fell off this hill into the insecure canyon down here, being like I didn't really know anything about actual clinical practice, because you can know the guidelines, you can read the research, but when you have a person in front of you and they want to have answers and you don't know them, or you don't know how to explain them, it's a big difficulty. But spending time here and feeling like I didn't know what I was doing was important to allow me to actually start to learn more and have the right opportunities with the right people like Luke to help me to become a better chiropractor rather than one that was just unhappy. So the process really had to start with me, because I realized that if I was going to be working in a clinic being told what to do, wasn't going to work, because I'd already discovered that, and my boss had told me it was my way or the highway, basically. So I realized that it was going to have to be me doing it. Maybe I just don't want to be told what to do, but I need to do it. And in order for me to act on the research, I think that I'd have to actually go through the process myself, because there's nothing more hypocritical than somebody telling you to do something when you know they don't do it themselves. And I didn't want to be that hypocrite. So I know many people in the past have been told to quit smoking by someone who smokes, or been told to lose weight by someone who's overweight perhaps, or been told to eat healthily by someone who eats pizza and chocolate all day. There's nothing more hypocritical than somebody saying you to do something and them not practicing what they preach. So I had to go through a process of learning about all this stuff, and my starting point was pretty rubbish, because I was very unhappy with my job. I'd kind of got into a bit of a rut, didn't do much exercise, was eating lots of chocolate, being quite unhappy sitting on the sofa watching TV to get away from thinking about how rubbish my job was. So I decided I need to start there. And in January 2020, so just before COVID kicked off and changed our lives, I started CrossFit, and I wanted to do more upper body work. I wanted to be able to do a pull-up, but my shoulder pain that I'd had for about 5 years on and off came back and started to get annoyed and irritated, and I didn't really know what to do. Now you would think that somebody who knows a lot about shoulders from learning all the anatomy and pathologies and so on and management of shoulder pain should know what to do, but actually when it was myself going through this, I felt I didn't really know what was going on. So I combined the mentorship that I was having with Luke with being a client of his to be able to rehabilitate my shoulder and go through the process of learning about pain neuroscience education and rehabilitation, which were things I didn't feel very confident in at all. And I think it's important, because the reason I had to go through this is because if I wasn't active, how was I going to make my patients be active? If I'm not confident with exercise prescription, rehabilitation, understanding pain, I'm never going to be able to help my clients in the best way possible. And there's lots of research that proves that point, really. So, you know, if you're an inactive student and they don't engage in exercise, they then don't pass that on to their clients. So the process started with me, and I've got a couple of videos of me doing some interesting things. This is probably the most embarrassing video of me. It was taken the very first day that I started exercising. I tried to do this exercise called an inverted press, and I couldn't do it. And I got the way down, and I couldn't get up again. It was terrible. And as you can see over here, this box here contains lots of chocolate that I was eating and being generally not very healthy. And I can see a lot of changes in myself that have happened since I've started from this day. So although it's a little bit embarrassing, I don't like the way that I looked then, I think it's really nice to see the changes that have happened. And this here as well is an exercise that I was doing with Luke to work on my shoulder strength and tolerance to overhead positions, which I remember the first time I did this exercise, I almost cried because it was so painful. And this was a really important experience for me now, because sometimes patients go through an exercise and it's painful. And if you haven't experienced pain, you don't really understand it. So the way that I was able to modify this exercise with Luke's guidance was really important, and has served me well when now I've seen clients who have an exercise, they're doing an exercise and it's painful. And this is something that was probably one of my first ever chin-ups, which was quite nice. I was able to achieve that relatively quickly with my palms facing towards me. Doing it with an overhand grip took a few more months, but it was really nice that I was able to achieve that quite quickly. And I still had shoulder pain at this point, so I was able to achieve my goal of a chin-up. I just wanted to make an aside on yellow flags, because as I remember when I was at WIOC, it was quite often patients would be referred to as yellow flaggy, and you know, there's lots of other things going on besides their pain. And I think it's important to pick up on that and say, actually, everyone is yellow flaggy. And for me personally, I was particularly yellow flaggy when it came to my shoulder pain, because I'd had about 5 or 6 different explanations for my shoulder pain. I'd been treated by 2 different clinicians at the clinic in 4th year. I then had treatment from a massage therapist who worked in the clinic where I was working. I'd had chiropractic adjustments, I'd had dry needling, Graston technique, some exercises, etc., etc. None of it worked. So I was a bit concerned. The chiropractor at the clinic where I worked wanted to ultrasound me and was talking about other potential things that I might need. And so I was quite worried about that. Add into that I hated my job. I was worried about my shoulder impacting my work, particularly doing things like side posture adjustments. I was starting to get shoulder pain during those. I was living far away from my family, and I was worried about my shoulder, having all these different treatments. So I think that it's important to say that everyone is a bit yellow flaggy. It's just finding out how much of an impact these have on them, rather than whether they're there or not, because everyone goes through stuff and has personal things going on that are going to contribute to whether their nervous system is more sensitive or it's less sensitive. So then the world changed as we know it, and COVID came along and changed everything. So I wasn't going to work every day, which was great because I hated it, but I wasn't earning any money, and that was rubbish. I couldn't go to the gym anymore. I couldn't then see Luke in person, which I was doing every week. And so it changed everything for how I was able to work. But the good news was I had loads of time. And so I spent pretty much most of the first lockdown exercising and understanding, reading, having meetings with Luke on Zoom, and learning as much as I could in order to help me when the lockdown eased and I was going to change and hopefully leave this job or try to implement what I was learning in my current job. So there's a couple of examples of things that I was doing. This was at my back gate. I got myself some rings, and I was learning how to get increased upper body strength and pulling strength using what I had available to me, which was a garden chair and a area to hang the rings on. And this other video, I found lots of places that I could exercise outdoors, and it was very nice weather in the first lockdown, which was very helpful. And I found this tree branch that became a frequent spot of mine when I went out for a walk. And this video is showing the first day that I discovered that I could get up from the bottom of a pistol squat. And I learned a lot about my own strength and quite determination as well from this, as it took me quite a long time to get there, but I did, and I was quite pleased with myself. So that kind of sense of reward was what I wanted to be able to pass on to my clients, to get them to achieve things that they maybe didn't think possible. So for the first time in my life, I was consistent at exercise, and I started to see changes in myself, strength-wise and confidence-wise as well. And also I realized that I didn't have to have a gym in order to get fitter and get stronger, because I've got all these options to being resourceful. I mentioned I was also doing lots of reading as well, and you don't have to read all these bits, but these were a couple of screenshots from a book I was reading called Aches and Pains by Louis Gifford. I don't know if I think it might be recommended reading for you guys. I would definitely recommend purchasing. It's a series of 3 books, and they're probably the best thing that I've ever read, especially at the point when I was really struggling with my clinical practice. For example, this first one over here is talking about somebody who had sciatica and nothing fitted into any kind of patterns that we'd learned at uni, and it just didn't make any sense. And when patients are in so much pain that they can hardly do anything, it's a big challenge. And this second example here is basically the guy Louis had done some treatment on someone, and he thought that he did a very terrible job, and the next day the guy was 100% better, and he had no idea why. And these kind of examples happen to me in clinical practice. I did some very terrible treatment, I thought, and somebody felt fantastically loads better, and then sometimes I did some what I thought was good and people got worse, and that's really confusing. So I would really recommend reading these books. They're really helpful for me, and I refer to them quite a lot now. So we'd had some lockdown, and after 3 months I'd been going through lots of different types of training, and I'd actually started to see loads of improvements in my strength, and my shoulder pain miraculously disappeared. And that was a really, really interesting moment for me, because before I'd thought that I needed somebody to do something to me for my shoulder pain to go away. And I'd had lots of people try to do things to my shoulder, mobilize it and adjust it and massage it and so on. But what had actually improved it was consistency of exercise, which I'd never had before. So it was a really, really important time for me to go through that process, because a lot of people, a lot of clients that you might see probably have the same situation. Now, obviously, manual therapy is still part of chiropractic treatment and what people do, but to be supported by exercise was a big thing for me. And obviously I couldn't go and see Luke in person due to lockdown. I'd also done lots of reading, some really good books. Explain Pain was fantastic, really, really good book, and Aches and Pains, like I mentioned. I also got the Why You Hurt card system, and that was really helpful for me to start to be able to explain things in ways that made sense to people. So I was having mentorship with Luke via weekly Zoom calls, and we were talking about training and how to improve my own training for my goals that I had, including more cool things like handstands and more pull-ups and so on, and learning about how to actually program exercise for people and for clients, similarly to PTs, but also more like into strength and conditioning, which is something I had little to no knowledge of. What I felt really important when I worked with Luke was going through these processes and doing things myself. So we did a lot of role playing of pain education. So some of the cards that are explaining different concepts about why things hurt, because Luke asked me the difficult questions and sometimes I didn't know how to answer them. But it was really good to have this preparation, because when clients ask you the difficult questions, you don't want to be sitting there and thinking, oh, I don't know what to say here. But sometimes that's actually the best thing to do, is not know and go and find out for someone. I also learned a lot about how to actually sell what I wanted to explain to people, because if you can have the best rehab program in the world, it can be wonderful in all the ways, but if nobody wants to buy it, if nobody wants to actually invest in what you do, then it's not going to be any use to anyone. So that was a really important part of the whole experience, because if I didn't know how to explain things to people, I was never going to get them on board. So I realized at that point I needed to quit the normal chiro job. And this is a couple of examples of things that I was doing. So this is one of the homework tasks from one of the pain education concepts. Getting me to be able to explain it back to Luke was the way of knowing that I actually understood what was going on. And this is a screenshot from when I was explaining to Luke about the envelope of function. He was asking me lots of difficult questions, but it was really, really helpful to go through that and practice these things and explain them to my family and friends, and make it so that I was able to do this to anyone and therefore be able to apply it to clients. So this is an important slide, I think, is the toolboxes. I was learning lots of different things. I already knew how to do manual therapy, and I always know, and I still know, that it's a useful tool, but it's not the only thing that we do. And I think that's often a misconception of what some people feel is evidence-based practice. It doesn't exclude manual therapy, but it just doesn't make it the primary thing. So all these other parts are probably more longer-term things, but manual therapy is still part of the short-term process that we can do to help people along the way to calming things down, which allows them to then be able to do more of the cool active stuff that we want them to do. So at this point, I decided to quit the chiro job where I was working, and I moved back home. So I was living in Gloucester, and I decided to move back to Southampton, where I'm based now. And that was really good for me, because when I was living back in Gloucester, I didn't really know anyone, and it was really hard to connect with people, especially when you don't have lots of family and friends surrounding you. So family and friends are really important to me. So being back home allowed me to network and meet people. In the summer, when the lockdown restrictions were slightly eased, I got myself a normal job, as you would call it. So I worked part-time in a golf club in order to earn a bit of money, but also to give myself some direction, routine, and so on, because I wanted to start my own business. I started working in a local gym, doing a mobility class and adding a clinical spin to it, so discussing things that may be relevant to people with aches and pains, because there's a lot of misinformation, and just starting to just challenge those things slightly and explain things in ways that people can understand, especially with things like, for example, tight hamstrings. Everyone feels like they've got tight hamstrings, but talking about muscle tightness and other things that contribute to muscle tightness, not just the fact that your muscles are tight, was really useful and allowed me to actually gain some clients from the class that I was running. I also took on my friends and family as clients, because at the end of the day, I was going to make loads of mistakes. And in order to make those mistakes, you'd rather make those mistakes on people who you already know and trust, and who already know and trust you. So I took on my parents as clients, my sister, my brother-in-law, my old maths teacher from school. There were loads of people that I took on as clients and went through a process of a program with them for their various aches and pains. And as you're probably aware, when people find out that you're a chiropractor, or that you're going to be a chiropractor, they're like, oh yes, I've got this problem. Oh yeah, my shoulder hurts, my back hurts. Oh yes, do you know much about knees? So it's important that you actually use that and be able to help those people, because if you help your friends and family, they're going to shout from the rooftops about how great you are. So that was really helpful to do at the start. I also had the support of Luke through mentorship, still having weekly calls with Luke even now. And because I was feeling still unsure when being young and inexperienced, got to start from the ground and build up. It can kind of only get better. So having all these times where you make mistakes and learn from them is really important. So many things go wrong regularly. Sometimes I come out of a session with a client and I think, oh, that went terribly. But it's okay, because I feel like I learn from it and make the next session better. So I worked with clients in program-based format, and that has massively helped me, rather than doing a pay-as-you-go model. Now, I know there's a lot of controversy, shall we say, about programs and making people pay up front for things and so on. But I think there's a difference between passive and active care programs. If there's going to be a pay up front for 20 sessions of adjustments with x-rays and reassessments to provide more adjustments, I personally find that ethically difficult to get on board with, and wouldn't really enjoy that work in that environment. But if it's an active care program, I feel like the idea is to get someone from sensitive, where their back may be sore or their neck may be sore, get them doing more movement, which they might be afraid of. That allows you to then build every week on what they did last week, and therefore they're already invested in, well, we've got 6 weeks, let's say, to get ourselves a better result. And therefore people, if they get worse, they don't leave, which is something that I experienced quite a lot of when I was in the clinic in Gloucester. You'd do some treatment with someone and they would get lots worse, even if you'd explain to them that it might happen, and they never come back. On the other side of things, people get better, which is great, and people get better particularly with acute problems, sometimes despite what you do, sometimes even if you do nothing. So those people, they maybe aren't the right type of client for a program where I work now, because I focus a lot more on the goals rather than pain, and allowing patients to have goals in mind rather than just, I don't want my neck to hurt, I don't want my back to hurt. That's obviously something that they've come to you because they've got pain. But when you have a goal to work towards, it means that the pain becomes less important and less relevant, and therefore usually it decreases anyway. I also have some business support available from where I work with Luke, and that's really, really helpful because I am still learning about business. I don't know very much about it. I'm self-employed, and learning things about tax returns and all this kind of stuff is it's beyond me for the majority of, for the most part, it's beyond me, but learning more about it has been really helpful. And these are just a couple of pictures of some things that I'm quite proud of. This is the mobility class that I was running at my local gym. This is when we had an open day, and lots of people came to try my class, and they really enjoyed it and had some really nice feedback. And lots of people are interested because they find out that you're a chiropractor and that you're into exercise, and therefore the expectation is already set that you're kind of a chiropractor that does exercise stuff rather than a chiropractor who just cracks backs. And that's an expectation that can be hard to overcome. This is another thing I'm quite proud of. This is my dad. This was on day 1. I got him to try and do a gymnastics bridge. He had shoulder pain, and that was why we were working together to help his shoulder pain. And this was 4 weeks later. He was able to do a significant amount more by working twice a week on shoulder stretches, exercises, strength work, and through learning that not all pain equals damage was really important. So the process for me now, it is, I run my own practice from my garage, and I've been well informed that all good, amazing businesses start from a garage. So, you know, Amazon and Google and so on. So I work in my garage, and this allows me to control the context and the environment. The things I have in the place where I work mean that people are expecting what I'm giving them. So I have a chiropractic bench, therefore they're expecting some kind of chiropractic treatment or manipulation. I have lots of weights, so they're expecting some kind of exercise or lifting weights, or there's some mats, so they're expecting maybe to do some stretches. But I also have posters and things that advertise the kind of stuff that I want to promote to my clients. So one thing I noticed when I worked in the previous clinic was there was lots of things on the wall like skeletons and nervous systems and degenerative spines and disc bulges, and that complemented what they were talking about. So now my posters on the wall are talking about envelope of function, talking about how the alarm system can get sensitized and what contributes to yellow flags and things like that. So that means that when I explain these things, it makes sense to people because the environment complements what I'm saying to them. I feel now so much more confident about what I'm doing. I still don't know everything. I don't think I'm ever going to know everything. I don't think anybody can, but I feel confident in my approach, and I feel that I can back up anything I do with evidence-based guidelines, research, and so on, so that I feel confident in what I do, rather than feeling like, oh, I'm doing this adjustment, I'm not really sure why, and the patient isn't really sure why, and they just want it because they think that's what a chiropractor does, and they don't really know how long it's going to take them to get better. So the process before was just a bit muddy and murky, and it just didn't really make sense to anyone. But now I feel much more like I've got a process that works. So I don't see that many clients. I'm not going to lie to you and say, oh yes, I see 30 clients a week and it's wonderful, because that's not how it is, and it's not how I want to do things. I see 5 to 10 clients a week. So last week I saw 6, I think it was. The week before I saw 5, week before that I saw 7. So it's not a great number of people, but I give them all time, and my sessions are usually between 45 minutes and an hour for a session as part of a program. And when I do consultations and reports of findings, they're quite a lot longer because I give people that time that they want. Especially with someone who's experiencing persistent pain, they really want you to listen to them. So I do a consultation and a ROF, and some people, they get that information from me and they say, thanks very much, Sam, I don't want to come on board and do your program. And that's absolutely fine. Sometimes that's all people need. But going through that process means that if I engage in a program with someone and they come on board, it means that we're already in the same boat and we're going somewhere together, rather than expecting to come to a chiropractor and have a fix. And that is a high proportion of chiropractic clinics and people who go to see chiropractors. So I think I've been able to create a nice environment that works for me and I think the client. So as I mentioned before, I work in program-based format that includes a lot of active care and education, as well as manual therapy when needed. It's still part of the process. I don't denounce manual therapy. I'm not anti-manual therapy. I just think that some clients need it, some clients don't, some clients expect it, and therefore it's part of meeting them where they're at. And some clients come to me because they've heard I do rehab, so they don't really care about the manual therapy. And now I feel much more confident in prescribing and doing exercise with clients. Therefore, the manual therapy is less important. So these are just a couple of examples of things that this is the Back to Roots chalkboard, which I use to explain things when I'm giving someone a report of findings. It allows me to visualize the process with them, talk about different concepts of the alarm system, talk about things like envelope of function, and explain things to people so that it makes sense to them and it's visual. And this is a great example of something that I get a lot of my clients to do. I get them to do some kind of reflection at the end of each session. And this is a good example down here. This client had a plantar fasciitis flare-up at the weekend, and they decided, based on what we'd talked about, that one way that we could manage this kind of situation would be to do some kind of exercise or activity. So she did some static cycling and she felt a massive improvement in her symptoms. And so it reinforced what we talked about in the previous session about calming down the nervous system. One way of doing it is through exercise. So I probably yabbered on enough. I want to talk a little bit about a couple of cases that I have, because I think this is really where the implementation actually makes sense. Because you can talk about it all day, but at the end of the day, it's examples that count. So this first lady that came to see me, she'd had 6 years of foot pain, cramping, and numbness. And to be honest, I was not sure if I was going to be able to help her at all, because she had it for such a long time. She'd been to see everyone that she could. Chiropractors, doctors, surgeons, everyone, foot specialists. She'd had surgery, she'd had x-rays, MRIs, she'd had the works. And nobody really knew what was going on. Nobody could explain the pain to her. They couldn't see anything really on her x-rays or MRIs. There was a bit of inflammation, but that didn't explain why her foot would cramp up and go numb. So she'd had all these different treatments that didn't work. And unfortunately, she hadn't been able to do all the things that she used to love doing. So she couldn't do any exercise really longer than about 15-20 minutes of walking. She had to stop and sit down all the time. She couldn't even do acting, which is something that really gave her good social interaction with her friends, because she couldn't stand up for long periods. So her goal was to just get back to any kind of exercise, anything at all. She was like, as long as it's something that I can do regularly that gets me active, I don't care what it is. And she wanted to be able to do things like have a shower without fear of her foot cramping or going numb in the shower and falling over. That was her fear. So when we examined this lady, it took a long time, and I think it was really important to give her that time. It took 2.5 hours in order to actually do the consultation, and she had a big story of who she'd seen and what they did and what went wrong, and there was a problem with the consultant, and then she complained, and then she went to see a podiatrist. There was a big story, and so it was important for me to let her tell that story and listen to it and understand the process she'd been through, because otherwise you're not going to be able to move forwards. When I did the examination, there wasn't really a ton wrong. So when I assessed her back, her hip, her knee, and her feet, and the only real problem was that her foot was just so sensitive that I could barely touch it without it being really sensitive, kicking off the numbness, the cramping. or anything. And it was a big challenge. I did some sensitivity testing, and I said, oh, if your left normal foot is 100%, what's your right foot? And she said 150%. Feels like it's almost double what's going on. And one of her goals was to get back cycling because she loved cycling, but she couldn't static cycle. I had a static cycling bike in the garage. She couldn't do it for more than 3 minutes before her foot didn't let her do any more. And she couldn't do anything single leg. She couldn't even lunge with that foot at the back. So it was a big, difficult challenge. So at this point I was like, well, should I do any manual therapy with this person? There's actually no point, because I could barely touch her foot. So what good was any massage going to do to it? What good was any foot mobilization going to do if I could barely touch it? So, well, what are we going to do instead? We did everything else that was part of a good evidence-based program. Movement was the key, because she needed to get more active, but you can't do that if somebody doesn't understand what's going on. I think that's probably one of the biggest problems in pain education, being something that people want to do a lot of because it's helpful to make people understand what's going on. But if you don't follow it up with movement, or if you do movement and don't follow it up with education, it's not going to work, because if they get pain during movement, they're probably going to stop. And if they are educated on it but they haven't applied it, it's not going to make sense. So doing both of them together was super important. And one of the biggest things with this lady that we did was visualization. And I'd never done this before with any client really, but we were talking about all the different bones of the foot, and she had very good knowledge of this because she'd been to see so many different consultants and specialists that she knew about all the bones of the foot. So we got her to close her eyes, and we were talking through each of the bones of the foot and imagining them in her mind's eye. And she said when she got to the middle, it went to mush. And I had no idea what that was all about. I was like fascinated by it. So I did lots of research about the importance of visualization and the idea of brain mapping, how areas in the brain can become smudged when they're not utilized, especially as she hadn't been using her foot because of the pain. So part of her therapy, if you like, was to practice visualizing different bones of her foot. And over a period of 3 to 4 weeks, she was able to start to actually see in her mind's eye her whole foot, rather than the middle part, which was just a mushy mess, she called it. So this is an example of some fun things that we did. We were doing some work on her balance with a game that was getting her to throw the tennis ball back and forth to me and make things a bit challenging. And we did it on both feet. And as you can see, it's challenging on both feet, not just on the foot that she had the issues on. So I don't actually know if you can probably tell from this one which one her more injured foot is. I think I might have told you at the start, but it was a really good process because she was really on board with all the ideas we talked about, and she found that the education really helped her to understand why things were hurting and therefore gradually start to push it and do slightly more. So now this lady is doing fantastically well. She can cycle on a static bike for 15 minutes with no issues, and she's still building up to doing more and more. She hasn't got back on a real bike yet, but that's her next goal. She's said that there's no issues in the shower anymore. She doesn't worry anymore, and she can stand on one leg and do everything that she needs to do. She can walk for over an hour without any problems, and her foot doesn't complain, she calls it. She recently went on holiday and she was walking up to 6 miles a day for 4 days, and she was absolutely fine. She said her foot didn't complain at all, and I was so proud of her for that because she's worked really hard. She's also got back to running, so she's been doing interval training like couch to 5k to get her back to fitness, and now she's got much better balance, and she's got really cool goals. So she wants to be able to run a 5k non-stop, and her next goal is to be able to do a chin-up, which we're working towards now. So this is just an example of what she's up to these days. She's was doing some deadlifts the other week, and I've been really impressed with her progress, and she's improved so much. But it was all part of the long-term process. We couldn't have just gone straight there, and that's why the program-based format worked so well, because if it didn't work after one session, it was never going to work after one session. So the whole process was the important bit. Okay, case number 2. This is a completely different case. So the first case, that was a lady who was inactive and needed to get active. This guy was a 29-year-old with an 18-month history of groin pain. And he was a gymnast. So he started cycling to work, and this had brought on some pain. But it didn't resolve after a few months, and he went to see the doctor. He'd been ultrasounded because they were concerned about other groin issues like hernias and so on, so they were concerned about that. He'd been referred for an MRI, and he went to see a urologist because the GP was concerned it might be a urinary or kidney related issue. And this was a big thing that there was a difficult belief to overcome with this guy is the urologist had told him that it might be referred from his back, and that he was convinced it was due to a leg length problem. And these kind of mechanical based reasons for explaining pain are not very well supported by evidence, but they're quite common that people will hear or have explained to them. So overcoming that was a big challenge. However, he'd also had some concerns because he thought maybe it might be something to do with testicular cancer or something like that, so he was quite worried. He wasn't really incapacitated by it, but he was really fearful. Now, this guy could do stuff like this. So I did not need to tell this guy to get active. There was absolutely no benefit in me telling him these kind of things, because he could already do things that many people would be jealous of, and he was strong in all manners. He trained regularly, and I didn't need to tell him you need to move more. So some people you need to tell to move more. He was not one of those people. So the question to think about is, why was he still in pain? So I did a full examination and so on, history, everything, ruled out serious pathology. The main thing was that it was a bit tender on his muscles in the groin area, adductors, hip flexors, and sort of flexion internal rotation was a bit sore. So physically, there's not a lot going on. It's not like I palpated and he was in agony. It was just always a bit sore. Yes, that's a bit sore there. So the main way that I worked with this guy was trying to get him to understand what was going on. But he was very skeptical. So he asked so many questions. He was like, well, this pain science stuff, it sounds logical, but I've never heard of this stuff. So, you know, how do I know you're not making this up? So to support that, I had to send him research papers to say, well, this is what this research paper's concluded about this. And that kind of helped him get on board with it. We did a thorough examination and talked about how healing times had been and gone. 18 months later, if you'd injured yourself, it would be healed by now. So going through the process of hurt not equaling harm and doing some movement to support this was really important. But I don't know if any of you guys have seen this task before, where you have to have a shoe on your foot and you have to get from your back to your front. This guy, obviously being a gymnast, you can't take the gymnast out of him. He decided to do it in the way that I wasn't expecting, with a backward roll. Normally people go sideways, but that was really interesting. So this I've written here, top down during bottom up. Now that basically just means that you can't just do exercise with people, or you can't just do education with people. If you do both of them together, it really helps to support the whole process that we were trying to achieve, was not getting him to be so worried about his hip. And this guy got better relatively quickly from his pain, because as soon as he appreciated that it wasn't such a big deal and that he wasn't in any danger anymore, he wasn't fearful of moving anymore, his pain sensitivity calmed down really quickly. So just to kind of finish up, because I know I've been talking a long time, and I hopefully haven't bored you too much. For me, in order to be evidence-based and to do things in a way that was going to make things work for me, there was never a right time. I could have said, you know, oh, I haven't got enough time for this because I'm working at the clinic all the time, or I haven't got enough money to be able to change things, and I need to get more experience in the clinic before I go and do my own thing. And I was quite worried about that. When I was at uni, I thought, well, I do want to start up my own business one day, but I'm not experienced enough and I don't know what I'm doing. But I think that there's never a right time. So for me, I kind of just had to bite the bullet and go for it, because before you know it, you'll be in the situation where you're graduated in practice, and if you do quite a similar way of treating people, you can get into a bit of a rut where someone comes in and you say, how are you doing? You assess their range of motion, you palpate them, you adjust them, you tell them to do a stretch, and then you tell them to go home. And that's quite boring. It's some people like that, but I personally just didn't get on board with that at all. So there was not a quick fix to change my whole way of practice. It took many months, and to be honest, I kind of am appreciative for a COVID pandemic for allowing me to have the time to really immerse myself in the process of changing the way I practiced into a more evidence-based way. But there is a process involved and it doesn't work out all the time. So my uncertainty and self-doubt are a lot less than they used to be, but they're not completely gone. Sometimes I get a patient in front of me and I'm like, I'm actually not sure what's going on here. But the support that I have now means that I am more likely to be able to make things work better rather than just being unsure and asking someone and getting advice that confused me. But the process is difficult and it takes time to get people on board. And at the end of the day, you see stuff on social media, people post, oh yes, my client's doing this, or oh, look how evidence-based I am, which you get a lot of on social media. But you have to appreciate that the day in, day out stuff doesn't get posted. It's only the good stuff. So take it with a pinch of salt. But the most important thing for me is to be surrounded by people that support me and that I believe in, because when I worked in the first clinic, I didn't believe in the clinics. I didn't believe in the clinic and the people who worked there, and so it just didn't work out. It was always going to be butting heads. I would say when you get into practice, or even if you're in the clinic now, don't be afraid to ask for help, because otherwise you can end up just being unsure and uncertain by yourself, and that doesn't lead to your patients doing well, because I think they definitely pick up on your self-confidence. I think the main thing that I would say now is I try to exceed my clients' expectations, and the process is difficult, but sometimes getting someone to do something they didn't believe was possible is kind of awesome. So this is my dad. He had shoulder pain and we worked on his shoulder strength, and one day I decided that we were going to try and do a headstand. Now, I would never have done that with any client ever before I'd worked with Luke and exposed myself to headstands as well. Now, as you can see, when he turned around here, he was extremely happy because he never thought that was possible, and it just massively violated his own expectations. So it doesn't happen overnight. We're not going to magically turn into an evidence-based clinician immediately or turn into a business immediately, but the process is I had to create this alternative over time myself. So my kind of tips to you would be, go through the process yourself. So be a client of someone who is in an evidence-based, who practices an evidence-based way, and make sure that you've got the right people around you. Try and keep up to date with everything as much as you can. I find that the people I choose to follow on social media now are ones who post about research regularly. For example, people like Craig Lieberson, obviously Luke and Paul themselves, people like that who give social media, that means when I scroll social media, I'm doing something useful, and I'm like, oh, I'm going to read that research paper now, rather than just being like, I don't know how to read research, I don't know where to find it. I would say that probably mentorship with Luke saved my career, because otherwise I wouldn't be sitting here talking to you right now. I probably would be doing some other job because I was so unhappy that I would have quit. So I'm now doing mentorship with others to be able to support them in the same way that Luke supported me, and it's such a rewarding process. Now, some people, you may listen to what I've said and think, yeah, well, I want to practice in this certain way as a chiropractor, and that's absolutely fine. I'm not here to be judgmental of any type of chiropractor, but the way that I work now was built on the fact that I was too critical of evidence and too critical of the curriculum at university and other chiropractors to find that a normal chiropractic clinic just wasn't for me. And so I've experienced it, and I think that's an important step. But now I'm able to use that experience and say, well, that's what people are used to. They're used to adjustment, a bit of soft tissue work, and a stretch, or maybe an exercise or two. And now the process I have is completely different. So I have definitely rabbited on for longer than I was meant to there. Thank you very much for listening. If anyone has any questions, feel free to let me know.